It's important to remember that osteoarthritis, the pathophysiology involves the entire joint. And so what that means is we really want to think of the joint like an organ. What I consider really the forgotten child when it comes to osteoarthritis is the synovium. I mean, the synovium is a very important structure because what it's doing is it's the driving force for admitting these inflammatory mediators and degradable enzymes that have a direct catabolic effect on the articular cartilage and cause breakdown of the articular cartilage. But at the same token, it's responsible for nutrient waste exchange. And if the synovium is inflamed, there's going to be a inability to remove waste, and so therefore we get a inflammatory joint fluid. Interestingly enough, in the canine, very minute damage to the articular cartilage will cause a really severe diffuse synovitis, more so than other species. We don't know why this is, but it's also the leading cause of pain and discomfort. Most of our products, we give something orally and we're just trying to blanket a pathway at a certain area. For some of our intra-articular injections, again, we're blanketing pathways, but this is a tried and true way to take a molecular driven approach, a targeted specific approach to directly what's causing pain and inflammation in the joint, and that's synovitis. And what happens here is the pro-inflammatory macrophages and synoviocytes engulf the radionucleotide and it causes apoptosis, essentially eliminating the source of discomfort in the joint. And then if we look at what was defined as a positive outcome means there was greater than a 5% improvement at any time point compared to the pre-treatment, which a increase of 5% on peak vertical force is actually pretty substantial. You know, some studies are only going to say greater than 2% is indicating a positive response. And so if we look at that at any outcome point, we see about 90% of dogs actually responded in a positive manner, which is quite astounding and actually really nice to have this information, because ultimately it gives us another tool in our tool belt that's not just blanketing, but is really targeting the source of pain and inflammation, especially if we have patients that are non-responsive to medication, certain medications, or patients that maybe can't tolerate certain medications, or owners just don't want to or can't give them daily medications. So if we look at a price per basis and duration per basis, right now synoviothoresis is going to be winning the game when it comes to duration by a long shot. We have to take a proactive approach to OA management and not a retroactive approach. I honestly, truly believe if we do things and we can tackle it aggressively, we can probably have the most profound effect on the course of the disease. The question is can we do something to possibly even alter the course of disease? And I think early recognition, early intervention is going to be the way to do that.